Some people really became so depressed that they became suicidal and tried to kill themselves. So the treatment was worse than the disease. And we started seeing tremendous results. We saw that there were these treatments that were very successful. People started doing the oral treatments. They kept living their lives. Welcome to our new episode of the Virtual Psychiatrist Unmuted. I'm Dr. Muhamad Aly Rifai. Today we're going to be talking about something that's very interesting. We're going to be talking about my story with how we killed a virus, how we cured people who had the virus. I recall the last few years standing in a clinic that no longer existed. The plastic chairs, the harsh fluorescent lights, tray of syringes, that all look and feel like a verdict. It's in the late 1990s. It was a young man sitting across from me, twisting a ball cap in his fist. He had hepatitis C. He had depression. We had a treatment at that time that can scar the mind, but also can cure the blood from hepatitis C. We warn him. We plan with him. We promise to walk beside him because the medicine may really pull his mind off, may make his sleep worse, may eliminate his sense of himself. And this was the world where I trained in the late 90s, a world where hepatitis C was a heavy sentence and hope came in small measured steps. Fast forward almost 30 years later. It's a different world. It's the same virus, hepatitis C, but there's a different ending. Hepatitis C now is a curable disease for the vast majority of people. Oral medications, pills that you can take, short courses, 8 weeks, 12 weeks, with minimal side effects. People walk out with their lives returned to them. In the past, it was a life sentence. The contrast still takes my breath away. A disease that was identified in the early 90s. And then we had a treatment that was severe. We got better treatments. The science made it. The insistence made it. And we got a cure now. Let's take a look back at the origins, at the roots of how this virus came about. For years, we fought a ghost, and this is like the 70s and the 80s. We called it non-A, non-B hepatitis. We knew that blood transfusion could carry it, because I lost a loved one. My aunt's husband, a famous obstetrician gynecologist, he developed hepatitis C from a needle stick while he was performing surgery. We knew that hepatitis C scarred livers, ended lives. Then the science caught the shadows. In 1989, the virus was identified, and in 1990, the first blood tests were in use in the United States. And that moment changed everything because in the blood supply, we finally had a name for this enemy. It was non-A, non-B hepatitis. They called it hepatitis C. We started screening the blood supply in the United States. And that moment changed everything. And we knew that there was a reservoir of people in the United States that had that dreaded virus. And we had estimates. 4 to 6 million people had that dreaded virus. And we could tell patients what was wrong with their liver, and we could tell them what they were experiencing. And clinics at that time were filled with patients who carried the virus. I worked at the Veterans Affairs Medical Center in a rural town in Virginia, and we had a lot of veterans. We had a lot of people who had used drugs. We had veterans who had used drugs while they were in Vietnam, and they all had hepatitis C. We had people who needed transfusions, mother who never knew where it came from because they had transfusion after delivery. The virus carried harm and a lot of social shame. But we knew that we had a sort of a treatment It was something called interferon, and it boosts our internal immunity to get rid of the virus. In those early years, the tools that we had, the interferon, was a blunt tool. Later on, we added another medication that was an antiviral, and the side effects were just horrendous and fierce. Fatigue, flu-like symptoms, bone aches, cognitive fog, mood changes, severe depression. People became suicidal, anxious, irritable, depressed. And me as a psychiatrist at the interface of medicine and psychiatry, doing my residency at the University of Virginia, that was my first time when that disease crossed my path. When I started my residency in 1998 at the University of Virginia, we'd only known about this virus for 8 years, but we had a huge reservoir of people in the general population. We had a huge reservoir of veterans who had the hepatitis C. We thought we had about 4 to 6 million people, and the numbers still stand. And this is where my path formed in terms of my involvement in a topic that intersected between medicine and psychiatry. I was awarded the American Psychiatric Association scholarship on severe mental illness to study this specific topic. And in my training as an internist and a psychiatrist, we started exploring, and we saw that a lot of those individuals that had hepatitis C also had a huge reservoir of psychiatric illness. And this was our first studies. And we were able to document the first association between hepatitis C and psychiatric illness. And we published our first paper, the American Journal of Psychiatry, Psychosomatics. We published that report. It still stands as the first report documenting the association between hepatitis C and psychiatric illness. We had to start working on it. We needed a bridge between the medical world and the psychiatric world to treat this dreaded disease. We built protocols for screening. We monitored mood when people got interferon. We prepared families to recognize changes. I wrote paper after paper to the tune of 75 papers in my career that addressed this issue. I published, I mapped the psychiatric landscape, the interferon landscape. It was the work of my career. And after I finished my residency, I journeyed to the National Institute of Mental Health, where I actually worked with the person who discovered hepatitis C in the early 70s and 80s and 90s. And he actually, ultimately in 2022, received the Nobel Prize for that discovery. As medicine changed, we wanted to be able to treat more people. And there was a recognition that the treatments that we have for hepatitis C, interferon, ribavirin, those antiviral treatments were not very effective. They could only clear the virus in about 20 or 30% if they're able to withstand the treatment. This was like chemotherapy. People became depressed, anxious, irritable, and some people really became so depressed that they became suicidal and tried to kill themselves. So the treatment was worse than the disease. And then the pharmaceutical companies sprung to action, and antiviral treatments that mimicked the antiviral treatments that got developed for HIV started coming in, and we started seeing tremendous results. Oral therapy for weeks, not like interferon, which was 6 to 12 months, weekly injections with interferon for 6 to 12 months. We saw that there were these treatments that were very successful. People started doing the oral treatments. They kept living their lives. They went to work, very little side effects, started caring for their children. But it was too late for the person that I love, my aunt's husband, the famous obstetrician gynecologist. He lost his life. He developed liver cirrhosis and liver failure from a needle stick as a surgeon, and he died. The medication was too late for him to save him. He had died in 2005. Now, this transformation was not just only clinical, it was moral. People got cured. people were able to figure out what they were going to do with their life. It wasn't that you had hepatitis C, that you had this disease that was going to kill you. You got recovery and you got cured from hepatitis C. You could tell your family, I'm not facing this disease anymore. Now, this disease was something that we didn't know. We didn't know that it was actually a disease that would inhabit both the liver and the mind. We later on found out that it was the cousin of the encephalitis virus. So it actually attacks the liver and attacks the brain. And we tried our best to see if we can get treatments that would hit both, and our success with developing these antiviral treatments. And that was where psychiatry, internal medicine, and addiction medicine overlap, because a lot of these people contracted hepatitis C from addiction, intravenous addiction to opiates. And that was the complex world that I lived in. And that was my origins: internal medicine, psychiatry, and addiction medicine. And I basically treated those individuals who had hepatitis C with psychiatric illness, with a lot of drug and alcohol issues, people who injected intravenous drugs to contract this virus. And a disease in my lifetime where a cure was developed, that was quite a miracle to witness. In my medical school, read about a disease, non-A, non-B hepatitis. In my residency, the virus was identified. We call it hepatitis C. There was some horrible treatments. We tried to help people take these horrible treatments that had very low cure rates. And then as I go into practice, I hear of these miraculous treatments that get discovered. Pills where people take the medication and their hepatitis C is cured. 8 to 12 weeks, pills every day, poof, hepatitis C is gone. And we got now treatments that are 99% cure rate. Everybody who takes the treatment almost is cured. Now, cure is a scientific word. It's a story. And cure does not erase the past, but it clears a path ahead. It reduces the risk for cirrhosis. It reduces the risk for liver cancer, lowers the burden on transplant lists, and cuts the chain for transmission. People don't get hepatitis C from other people who got cured because they cleared the virus. It's no longer in their body. Let me tell you, it was an honor for me to be in that journey, meeting the scientist who sequenced the virus, Dr. Alter, who ended up receiving the Nobel Prize for discovering non-A, non-B hepatitis and hepatitis C. He built the first antibodies for testing. The fact that he collaborated with the Centers for Disease Control in the 90s so they could screen the blood supply, so they could stop the transmission. Those scientists at the National Institute of Mental Health and at the National Institute of Health who were able to identify that interferon as an agent was able to help people clear the virus, and then adding another antiviral to it, ribavirin. And basically, that was the story of a disease that we discovered and we treated. And that was a very interesting journey for me, because with that, there were public health implications, the psychiatric aspects, the drug and alcohol issues. These are all kind of things that shaped my career because I wrote about them. Now, in my early career, I spent my days in clinics that had mixed hepatology with psychiatry. When I traveled to the National Institute of Mental Health, I was basically the psychiatric liaison for the gastroenterologists who were treating hepatitis C to try to help them manage interferon treatment in people who had depression and anxiety and bipolar disorder and drug and alcohol issues, and a lot of papers that I wrote about how to manage these psychiatric complications that are not all history in the bowels of history books, because now we have a treatment. We don't have to worry about these psychiatric issues. But it was all experience for us. And a lot of that experience that we encountered from being able to manage psychiatric and medical illness at the interface of severe medical illness came to fruition because In the year 2020, we had another medical illness that had a lot of psychiatric complications. We had the coronavirus disease, COVID-19, that came upon us and carried a lot of psychiatric issues, as well as even when it was gone and cleared, carried a lot of complications. We've talked about that in our previous podcast. It was that journey that really helped me and positioned me to be able to help during the COVID pandemic. It is very interesting how the divine kind of sets up things with hepatitis C being discovered in the 90s, us working on it, working on the psychiatric complications, and then seeing how that knowledge that we gained on the interface between medical and psychiatric illness was instrumental in our ability to work on individuals who have long COVID, people who had the syndrome and then had to deal with the complications after that. There's remaining work. I don't think that we're done. People still carry the virus. Some people don't know that they carry the virus. So actually, the Center for Disease Control has actually asked that everybody be screened. Every American needs to be screened for hepatitis C. So we want to make sure that everybody gets screened and to make sure that nobody has hepatitis C, a disease that could be easily cured, 8 to 12 weeks of a once a day pill. So this is a solvable problem, but we want to normalize testing for the general population. This is a call for my colleagues. Screen every patient that you have out there. We need to screen every American for hepatitis C and make sure that they don't have hepatitis C because we've solved this problem. We cured the disease. And that also devies into the COVID-19 and screening actually everybody who had COVID-19 to see if they have any long COVID or post-COVID issues. So to my colleagues, if you are listening and you wonder if you have ever been tested, ask your doctor. To my patients, ask your doctor, was I ever tested for hepatitis C? Because one test can change the arc of your life. I tell all my patients who have a history of drug use or blood transfusion, you deserve respectful care, their path to treatment. We now screen all pregnant women to ensure that they're not passing hepatitis C to their fetus, nor if they have hepatitis C that they abstain from breastfeeding because it could be transmitted that way. And clinicians can tell you horror stories about the old days, how people died from hepatitis C because we had no effective treatment. But today, we have cures. We have treatments that you can take and that can cure hepatitis C. To my fellow clinicians, order the test. It's a simple test. Hepatitis C antibody. And if it's positive, confirm it with an RNA viral load. Basically, it'll tell you if the hepatitis C virus exists in there. You can do an ultrasound, you can stage the liver, you can figure out which viral type is there. But these are not important anymore because treatment is there. Success in treatment is available. If your patient has mental health issues, invite a psychiatrist to participate in treatment very early. Not because the new medication is required, but because collaboration builds the trust, improves the outcome. People who have hepatitis C also have psychiatric illness. The treatment is recommended for everybody with hepatitis C. The default is to cure. Basically, cure everybody from hepatitis C. And as a psychiatrist, I always ask my colleagues to keep hepatitis C in mind during talking to patients, asking routine questions about the risk factors, blood transfusions in the past, before 1990 for older people, intravenous drug use, and you can see people opening up, talking about drug use, and you can see how the stigma just dissipates because they know that this is a disease there's a cure for. These are moments that can keep somebody who's in the field of medicine going. The first time you lower a fever in a child who looks at you with clear eyes, the first time you have a suicidal patient that you put in the hospital and they return and tell you that the darkness is gone, that the suicidal thoughts is gone, the first time you have a person with hepatitis C that brings that lab report with words, not detected, no virus is detected. And cure is not just the lab results, it is a restoration of a possibility. People no longer will get liver cirrhosis, liver failure, death from liver cancer. It's a new lease on life. Now back to that clinic that I attended, the medicine psychiatry clinic where we worked on hepatitis C. We identified the disease of how we identify a treatment. The treatment was horrible. We got better treatment. We identified that it was associated with psychiatric problems. We treated the psychiatric problems. We dismantled barriers. We listened. We worked with our patients. We didn't turn them away. We worked with individuals who had drug use issues, and we cured them from this virus that was going to take their life. We helped them with their psychiatric issues. And as I watched this field change across 3 decades of my career, I will never tire saying the words that were once impossible and they became possible. Hepatitis C virus is gone. That's my career. The virus was discovered. We tried treating it with interferon. It was horrible treatments. We treated the psychiatric issues, and then better treatments were discovered. And now the disease is almost history. Thank you for coming with me on this journey of part of my career on the diaries, the Unmuted Diaries of the Virtual Psychiatrist. Please share it with someone that you know that may be at risk. Talk to your patients. Cure is there. Talk to other colleagues to ask them to test everybody because the cure is here. We have cured this disease. And I am honored to have been part of this process of developing this cure for this disease, because hepatitis C is no more. It's no longer a killer. We cured a disease. And until next time, I'm your host, Dr. Muhamad Aly Rifai. I'm a professor of medicine and psychiatry, and these are the diaries of the Virtual Psychiatrist. Thank you.